Dementia Network was set up in 2013. Dementia networks were mandated by NHS England, and so the funding came through in April 2013, and we launched our local network in September that year. It was built on the model of existing networks, so cancer networks and heart disease networks have been running for a long time, but there hadn't been networks for mental health or dementia, and it was recognised that there was a need in that area, that you'd got enthusiasts who wanted to come together to almost get a head of steam, if you like, behind work in that area. I mean, the remit initially was very broad, so it was literally around improving care for people living with dementia and improving health services, particularly for that group of people. So we've involved people affected by dementia, I suppose primarily in projects where we felt their input would be most valuable and where they would also be able to see how their input has had an effect. So that's ranged from, for example, at the moment we're developing care plan resources, and we're consulting with existing groups across Yorkshire and Humber about what that content should look like from a carer and patient perspective. I think we've contributed towards the head of steam, which has sort of worked up around dementia over the last few years, alongside other partners like Dementia Action Alliances and Dementia Friendly Communities. We, I hope, have given people affected by dementia a voice and an ability to influence clinicians, particularly through events and meetings. And we also, with some specific feedback that we've had from third sector organisations that are about our role in enabling their engagement and their access to healthcare. We have used the matrix, the maturity matrix toolkit. We use that both as an internal team and also with our external stakeholders, and it helped us to identify blind spots, I suppose. So where we thought we were doing okay in terms of stakeholder engagement, it actually flagged for us some areas where which we really haven't addressed.